Well, thank you so much, Tony. And it's good to be with all of you this morning. Before I start, I just want to take this opportunity, even though it's a few days late, to wish Dr. Rochelle Walensky a happy birthday. Her birthday was on April 5th. And Rochelle, I will spare you my rendition of happy birthday. I don't think anyone would appreciate that, but happy birthday nonetheless from all of us. I want to just take a moment today to talk a little bit about where we are with vaccine confidence and with our education campaign. You've heard a lot from us about the state of the COVID pandemic. We've talked about it in terms of cases and hospitalizations and vaccination numbers. But I want to start today just by sharing with you a little bit more about what we've learned about the toll of the COVID-19 pandemic. For many Americans, this pandemic has not only impacted our physical health and well-being, but also the mental health and well-being of our children. This week, we learned, for example, that an estimated 40,000 children in America lost a parent to COVID-19, according to a new model from researchers. This week, scientists found that 1 in 8 people with COVID-19 were diagnosed with a new psychiatric or neurological condition in the following 6 months, and anxiety and depression were among the most common conditions. Millions of people are experiencing symptoms of anxiety and depression right now. And research from the CDC has showed that younger adults, racial and ethnic minorities, essential workers, and unpaid adult caregivers have experienced disproportionately worse mental health outcomes during this pandemic. Now, these numbers are sobering, but they are not altogether surprising, because many of you know intuitively of these struggles. Maybe you or a loved one has been wrestling with mental health challenges. We may not talk about them as often, but we're experiencing them nonetheless. And the administration is taking mental health challenges related to the pandemic seriously. It has provided nearly $3 billion to states and territories to address mental illness and addiction crisis. And the American Rescue Plan included around $3.56 billion for the prevention and treatment of mental health and substance use disorders. The mental health consequences of COVID are yet another reminder why people getting vaccinated is so important. It's our quickest path to ending the pandemic. And for all the suffering that COVID-19 can bring, I've also personally seen firsthand the joy and relief that vaccines can bring. Just yesterday, in fact, a friend sent me a picture of her 2 children hugging their grandmother for the first time in 16 months. And she wrote 3 simple words in her text: hugs are back. And I myself find that I breathe easier each day seeing my father and my sister go to their medical office to care for patients because I know that they are vaccinated. And when I received my own second dose not too long ago, I felt a wave of hope that I hadn't experienced in months. These vaccinations were made to help us return to our lives and to the people that we love. And that's why the president has asked that by April 19th, just 10 days from now, all adults be eligible for the vaccine. Now, as more and more Americans gain access to the vaccine, I'm happy to share that vaccine confidence is rising across the country. In December, a survey that showed that 34% of respondents were ready to get a COVID vaccine, quote, as soon as possible, end quote. That same survey in March, just 3 months later, found that 61% of people reported either already being vaccinated or wanting to receive a vaccine as soon as possible. This is an encouraging trend, but we still have more work to do. Millions of people still have questions about the vaccine, and misinformation and disinformation continues to spread. That is why we are working hard to give people the facts about COVID-19 through a variety of channels, the most important of which is trusted messengers. The research tells us clearly that people want to hear from people they know and trust when deciding about the vaccine. For example, a survey in January showed that more than 3 in 4 adults in the United States have said they would likely turn to a doctor or nurse or other healthcare provider when deciding whether to get the vaccine. In that same survey, more than half of people said they'd likely turn to family or friends about whether to get vaccinated. That's why last week we launched the COVID-19 Community Corps, and we're working with partners across the country to help deliver science-based information to community members, friends, and family. And in just 1 week since our launch, we've gone from 275 partners to nearly 5,000. And these partners include faith-based organizations, civic organizations, industry groups, individuals, health professionals, sports leagues, and so much more. In the last week alone, I've heard stories about doctors and nurses who are now going door to door to help people learn about the COVID-19 vaccines, I've heard about churches setting up vaccine education and administration sites in their building. I've met grandparents who are now talking to their kids and grandkids about the importance of getting vaccinated. To end this pandemic, this is what we have to do. We've got to step up and help protect one another. And that's why today I'm asking everyone to do two things. One, get vaccinated as soon as you can. And two, help the people you care about get vaccinated as well. Ask your family and friends if they have a plan to get vaccinated. If they have questions, talk to them about the facts. Encourage them to talk to their primary care provider. And you can get resources, fact sheets, and toolkits at wecandothis.hhs.gov. We've made extraordinary progress on the vaccine campaign, and what we've already accomplished gives us faith that we can accomplish the task ahead. But it will take all of us stepping up to help the people we love to get vaccinated. Thank you very much, and we'll look forward to your questions.